Let us begin by hoping that all of you listening has had a wonderful week. So now, onto this week's Al-Ghaf Dynamics HealthConnect Middle East podcast episode. Today, we will be once again discussing key events these past 7 days in the Middle East region across healthcare, life sciences, and wellness. Areas that are not only important to the Middle East population, but to the respective ministries, organizations, hospitals, healthcare providers, pharmaceuticals, biotech, and wellness groups. You will hear trends, insights, and the latest developments across the Middle East region for the week leading up to July 31, 2025. As always, our information is drawn from regional health ministries, pharma and biotech institutions, advanced data and news outlets coupled with our internal data gathering platform, HealthConnect Middle East. The last week of July brought into sharp relief the Middle East's contrasting healthcare narratives. On one hand, Gulf states accelerated ambitious health sector expansions, opening world-class hospitals, launching national insurance schemes, and investing in research and digital innovation. In countries like the UAE, Kuwait, and Saudi Arabia, government initiatives underscored a drive toward high-tech, quality-focused care aligned with long-term visions. Conversely, conflict-torn and crisis-hit nations such as Gaza, Yemen, Lebanon, and Syria struggled with acute public health emergencies. Malnutrition and disease outbreaks reached grim milestones in blockaded and impoverished areas even as international agencies stepped up relief efforts. Across the region, themes of modernization and resilience ran parallel with urgent humanitarian needs. This comprehensive report examines key developments of the week across policy, innovation, industry, public health challenges, wellness promotion, digital health, hospital infrastructure, and population health management, highlighting both the strides and setbacks shaping Middle Eastern health and wellness. First is healthcare policy and government initiatives. Government-led health reforms and strategic programs were prominent this week. In the United Arab Emirates, UAE, authorities pursued innovative policy approaches to improve health outcomes. The Ministry of Health and Prevention, MOHAP, announced a partnership with the Behavioral Science Group of the Presidential Court to infuse behavioral insights into health and social policies. By training staff in behavioral science and deploying data-driven interventions, the UAE aims to foster healthier lifestyles and more proactive public services, aligning with the UAE 2031 vision. In Abu Dhabi, the Department of Health launched a value-based care incentive program, rewarding exceptional quality, to shift provider payments toward service quality rather than volume. The new model debuted in fertility clinics and will expand to other fields, offering financial rewards to hospitals and clinics that meet stringent outcomes and patient experience targets. Officials emphasized this as part of Abu Dhabi's strategy to raise healthcare standards and become a world-class medical hub. In Bahrain, a landmark health financing reform moved forward. The Supreme Council of Health confirmed the rollout of a mandatory national health insurance scheme, dubbed the Hakim Program, by the end of 2025. This week the government invited bids from insurers to administer the scheme, which will ensure all residents, citizens and expatriates alike receive essential primary, secondary, and emergency care coverage. The 5-year plan is designed to engage private insurers and providers in delivering services, while bolstering regulatory oversight to maintain quality standards. Bahraini officials highlighted that the Universal Insurance Program will promote efficiency, encourage preventive care, and secure the health system's financial sustainability. It also complements Bahrain's ongoing efforts to achieve international hospital accreditations and implement stronger governance across the sector. Major health infrastructure initiatives advanced in Kuwait as part of its National Development Plan for 2024-2025. The Ministry of Health reported that it is managing a KD 140 million, almost equal to $55 million, portfolio of 20 public health projects aimed at modernizing care delivery and expanding capacity. 13 projects are under active execution, 2 new hospitals are nearing completion, and several others are in preparatory stages. Notably, the new 600-bed new maternity hospital in Kuwait City, a state-of-the-art facility, began opening services this year and will fully open its inpatient towers and operating theaters in the coming weeks. Similarly, the new Sabah Hospital, a 512-bed general hospital, and the new Oman Hospital complex are well underway, while a specialized communicable diseases hospital and an expanded Kuwait Cancer Center, 618 beds, fully automated systems, are slated to open imminently. Health officials stressed that all these projects adhere to international standards and will vastly increase Kuwait's inpatient and critical care capacity. In tandem, the Kuwaiti Health Ministry deepened international partnerships to support these initiatives. In July, Health Minister Dr. Ahmed Al-Awadhi signed 5 memoranda of understanding in Paris with leading French medical institutions to collaborate on specialty care services. These French partnerships will bolster Kuwait's capabilities in oncology, cardiology, and organ transplantation, and include developing telemedicine links so that Kuwaiti doctors and patients can tap French expertise remotely. Kuwait also renewed domestic interagency agreements to advance its Healthy Cities program, aiming to translate health promotion policies into on-the-ground improvements in urban health. With 18 municipalities now in the WHO's regional Healthy Cities network, 7 already accredited, Kuwaiti authorities are using this framework to integrate public health considerations into local governance and urban planning. In Jordan, the government took bold steps to upgrade healthcare infrastructure through foreign investment. On July 26, the Prime Minister oversaw the signing of 2 major agreements with Saudi-based investors to inject $187 million into Jordan's health sector. The first deal, with Saudi Arabia's KBW Investments, will finance construction of a modern new government hospital in Madabad, Jordan's first public hospital built via a public-private partnership. Planned as a 260-bed facility, expandable to 360, with comprehensive surgical, emergency, and dialysis departments, the hospital will be fully government-operated when it opens in 3 years. The second agreement, between the Jordan Armed Forces and a tech firm partly owned by the Saudi investor, will digitize the military's medical services, introducing an electronic system to manage inventory, laboratories, and radiology across army hospitals. Jordanian officials hailed these deals as a significant step toward modernizing health infrastructure and indicated more partnerships are planned in transport and additional hospitals. These initiatives tie into Jordan's broader strategy to leverage private and Gulf investor capital to improve public services without straining the treasury. Meanwhile, Lebanon remains in a state of protracted health emergency, but received a glimmer of strategic support this week. The Ministry of Public Health and the World Health Organization jointly launched a new country cooperation strategy for 2026 to 2029, aiming to stabilize and strengthen Lebanon's collapsing health system. After years of economic depression and political paralysis that have left hospitals short of medicines and staff, the WHO's regional director visited Beirut on July 26 to reaffirm international commitment to Lebanon's health sector recovery. International donors are focusing on shoring up primary healthcare centers as a lifeline for vulnerable communities. For example, a high-level ceremony on July 23 marked France's Agence Française de Développement, AFD, funding to support the Bazouria Primary Health Center in southern Lebanon, part of a broader program to keep over 200 primary care clinics operational nationwide. These efforts, alongside humanitarian shipments of essential medicines, are policy stopgap as Lebanon works to implement longer-term health sector reforms once governance and financing conditions improve. Across the region, other policy moves underscored an emphasis on preventive care and system resilience. Saudi Arabia, in the wake of a safe and disease-free Hajj season earlier in the month, continued to prioritize health security as part of its Vision 2030 transformation. Officials noted that extensive advance planning, from mandatory vaccinations and fitness screenings for pilgrims to deploying thousands of health workers, ensured that no epidemics arose during the mass gathering. The kingdom's health sector transformation program, under Vision 2030, explicitly ties such successes to cross-sector cooperation and investment in public health readiness. And in Oman, while no major new policies were unveiled this week, authorities are steadily implementing initiatives under Oman Vision 2040. These include modernizing the disease surveillance system, as seen in May's launch of an event-based epidemiological surveillance project to complement traditional reporting, and integrating a One Health approach into national health security planning. Overall, the week's policy landscape showed Middle Eastern governments balancing immediate post-pandemic and conflict-related recovery needs with visionary programs for the future. From Gulf states investing oil wealth into next-generation health systems, to aid-dependent countries seeking stopgaps to prevent total collapse, health policy remains at the forefront of national agendas. Notably, collaborative governance, whether through public-private partnerships, international agreements, or interministerial initiatives, emerged as a common thread in addressing complex health challenges at scale. Developments in life sciences and research innovation is next. The region's commitment to advancing medical research and innovation was evident in several developments. In Egypt, one of the Arab world's scientific powerhouses, a new international research collaboration was formalized. The government's Theodore Bilhas Research Institute, TBI, signed a Memorandum of Understanding with China's Wuhan University to jointly combat endemic diseases, especially schistosomiasis. Announced on July 16 in Cairo, the renewed partnership builds on earlier cooperation and will include establishing a joint research laboratory in China focused on schistosomiasis parasites and their snail hosts. Egyptian and Chinese scientists will exchange expertise, organize joint symposia, and publish findings together, aiming to accelerate breakthroughs against a disease that has long affected rural communities in Egypt. TBI's leadership lauded the agreement as a model of scientific openness that will give young researchers opportunities to innovate and strengthen Egypt's research capacity. This reflects a broader trend of Middle Eastern institutions seeking global partnerships to tackle local health priorities through science, in line with Egypt's Vision 2030 emphasis on knowledge transfer and research-driven policy. Local research accomplishments also made news. In Egypt, scientists celebrated a homegrown biotechnological success, the award of a new patent for a method of producing genetically engineered therapeutic proteins. On July 27, TBI's acting director congratulated two of the institute's senior researchers, Professor Mohammed Ali Saber and Professor Ihab Eldababa, for securing a patent via Egypt's Science, Technology and Innovation Funding Authority. Their innovation involves using biotechnology techniques to create recombinant therapeutic proteins for medicine, a cutting-edge achievement that underscores Egypt's growing capabilities in biologic drug research. This marks a significant milestone in the country's efforts to foster indigenous pharmaceutical R&D and reduce reliance on imported biologics. The development was hailed as a new scientific achievement for Theodore Bilhas Institute and a testament to the success of national research funding programs. It also aligns with Egypt's ongoing national strategy for science, technology and innovation, which aims to turn research institutions into engines of economic and health sector development. In Qatar, a country investing heavily in biomedical science, contribution to a major global study was highlighted. Sidra Medicine, Qatar Foundation's flagship women and children's hospital, announced that its researchers co-authored an international study mapping human and mouse adipose fat tissue at the single-cell level. The study, published in early July, is part of an ambitious effort by scientists worldwide to catalogue how fat cells function and interact, which has implications for understanding obesity, diabetes, and metabolic disorders. Sidra's team provided data and analysis from Qatari patients, integrating it into a comprehensive cell atlas of adipose tissue. By helping to chart the molecular profile of fat cells, Qatar is positioning itself in the forefront of precision medicine research. Sidra Medicine noted that such collaborations enhance Qatar's research profile and directly inform its own precision nutrition and metabolic health programs. The findings will potentially guide new treatments for diabetes, a disease of high priority in the Gulf, and underscore Qatar's commitment to scientific contributions that transcend its size. Saudi Arabia is likewise leveraging research to inform policy and innovation. Earlier in July, the Saudi National Institute of Health announced a series of 2025 research grant opportunities targeting national health priorities in cardiovascular disease, diabetes, and cancer. This week, although no new grants were issued, the kingdom's broader research ecosystem was in focus as officials assessed proposals. The program, aligned with the Vision 2030 transformation goals, is meant to spur translational and clinical research that directly improves care protocols. Moreover, Saudi representatives actively engaged in global scientific forums, from the BIO International Convention in the United States last month to preparations for the upcoming Global Health Exhibition 2025 in Riyadh, signaling the kingdom's desire to attract research partnerships and biotech investment. These efforts reflect how Saudi Arabia, much like its Gulf neighbors, sees scientific innovation as integral to its future healthcare system. In sum, the Middle East's life sciences landscape in late July showcased a mix of collaborative and homegrown achievements. Countries with established research infrastructure, Egypt, Iran, Qatar, Saudi, accelerating initiatives in genomics, biotechnology, and disease-specific studies. Even smaller states and those rebuilding from conflict are tapping into international networks to bolster research capacity. A unifying thread is the understanding that innovation and evidence are key to tackling endemic health issues, from parasitic diseases to lifestyle-related illnesses, and to reducing dependence on imported solutions. The region's investment in human capital, through training programs, like Oman's field epidemiology training program that graduated new cohorts this quarter, is creating a pipeline of skilled researchers and public health experts. Over time, these efforts are expected to yield more contextually appropriate interventions and strengthen the Middle East's voice in global health research dialogues. What about biotech and pharmaceutical developments? The week saw significant developments in the Middle East's burgeoning biotech and pharmaceutical sector, underscoring the region's ambition to become a producer, not just a consumer, of advanced therapies. Egypt provided a prime example with the news of its latest biotechnology patent. The patented innovation for producing therapeutic proteins via genetic engineering is not only a scientific feat but also has commercial implications. Such recombinant proteins can form the basis of new biologic drugs, for instance, growth factors, enzymes, or monoclonal antibodies for treating various diseases. By securing intellectual property in this arena, Egyptian researchers are laying groundwork for domestic biotech startups or partnerships to manufacture high-value biologics in-country. This dovetails with Egypt's push to localize pharmaceutical production, as seen in recent years with Egyptian firms licensing hepatitis C and insulin drug production, and reduces reliance on costly imports. The Science Ministry in Cairo has encouraged this trend by funding translational research and streamlining regulatory pathways for biotech products. As a result, Egypt is emerging as a North African biotech hub, able to serve regional markets with Arabic-labeled, locally tested therapies. In the Gulf, investment in pharmaceutical manufacturing and innovation also advanced. Saudi Arabia, as part of Vision 2030, has been aggressively courting pharmaceutical companies to produce in the kingdom and transfer technology. This week, industry observers noted the follow-through of deals signed earlier. For example, the memorandum with China's SNIDE Diagnostics, signed in April, is moving into implementation, paving the way for integrated diagnostic production facilities in Saudi Arabia. Likewise, partnerships with global medtech firms like Mindray and Huawei, which Saudi officials mentioned in spring, are translating into concrete projects in digital diagnostics and smart hospital infrastructure. While these specific deals were inked months ago, the latter half of July saw progress reviews and planning sessions to ensure these ventures stay on track. The upshot is that Saudi Arabia is steadily building local capacity in pharma and biotech, constructing manufacturing plants for vaccines and biosimilars, supporting local startups in genomics and cell therapy, and leveraging the large Saudi market to negotiate technology transfer. An example on the horizon is the planned vaccine manufacturing center in Riyadh, which officials aim to have operational by late 2025 to produce routine immunizations and even mRNA vaccines domestically. The kingdom is also incentivizing clinical trials by simplifying approvals, a strategy that bore fruit as Saudi sites have begun participating in Phase 3 trials for cutting-edge gene therapies this year. These developments align with the government's goal of becoming a regional pharmaceutical supply hub and exporter in the next decade. In Kuwait, Qatar, and the UAE, pharmaceutical developments are more in the form of partnerships and regulatory milestones than indigenous drug discoveries, but these are laying a foundation. Qatar, for instance, via its Qatar Science and Technology Park, is incubating startups focused on precision medicine and has attracted branches of international pharma companies to conduct research or pilot projects in Doha. The Sidra adipose tissue study participation is one example of knowledge generation that could inform new treatments. the UAE's Dubai Science Park and Abu Dhabi's Hub 71 are likewise nurturing health tech and biotech ventures through funding and mentorship. This week, no major new pharma plants were inaugurated in these states, but ongoing projects were noted. Construction of the UAE's first large-scale vaccine production facility continued on schedule, a joint venture with a Chinese pharma giant, and Dubai's authorities reiterated their aim to increase locally manufactured pharmaceutical products by 20% within 5 years, partly by offering incentives for generic drug production. Additionally, the GCC as a bloc is working on harmonizing regulatory standards for medications, a topic of discussion in late July's meeting of Gulf health ministers. This will streamline drug approvals across the 6 GCC countries, potentially attracting pharma companies to use the Gulf as a single market for launching products. Such regulatory integration, combined with high per capita pharmaceutical spending in the Gulf states, makes the region increasingly attractive for pharmaceutical investment. In summary, the Middle East's pharmaceutical and biotech sector is steadily transforming. Countries like Egypt and Iran are demonstrating that local scientific talent can yield patented innovations and exportable therapies. The wealthy GCC states are leveraging partnerships and investments to build manufacturing capacity and introduce advanced medical products into their health systems, including telemedicine and AI tools as adjuncts to pharmaceuticals. As these nations diversify their economies, pharmaceuticals and biotechnology are seen as high-value industries that can contribute to knowledge economies. The progress seen in the last week of July, whether a new patent, a trade agreement, or the quiet opening of a new production line, all feed into the region's long-term vision of health security and economic diversification through life sciences. Challenges remain, including the need for skilled workforce development and navigating geopolitical risks, but the trajectory is set. The Middle East aims to be not only a consumer of medical innovations but also a creator of them. Now let's switch to public health challenges and disease outbreaks. Public health challenges across the Middle East ranged from war-related humanitarian crises to communicable disease threats and environmental health risks. In Gaza, the already catastrophic health situation worsened further in late July, drawing urgent warnings from health agencies. The World Health Organization reported that malnutrition rates in Gaza have reached alarming levels after nearly 2 years of blockade and conflict. Tragically, of 74 known malnutrition-related deaths in Gaza so far this year, 63 occurred in the month of July alone, the majority of them children under 5. Hospitals in Gaza, crippled by shortages of food, essential medicines, and fuel for generators, have been unable to save severely malnourished patients who, under normal conditions, would recover with proper care. Local officials in Gaza noted that by the 3rd week of July, famine and malnutrition had officially been listed as the cause of over 150 deaths since the war's escalation, and the toll rises each day. Moreover, infectious disease outbreaks loom as sanitation systems collapse. Healthcare workers have detected upticks in diarrheal diseases and skin infections in overcrowded shelters. A UNOCHA update mid-month highlighted that only 18 of Gaza's 36 hospitals, 50%, were still partially functional, and even those were operating at greatly reduced capacity. Some relief reached Gaza through humanitarian convoys, but health officials emphasized it was a fraction of what is needed. The humanitarian community pleaded for sustained ceasefires or safe corridors to allow food and medical supplies into the enclave to avert a full-blown famine and epidemic. The Gaza crisis starkly illustrated how war can precipitate a multifaceted public health disaster combining trauma injuries, disease outbreaks, and malnutrition when healthcare infrastructure is under fire and basic needs are denied. In Yemen, another protracted conflict zone, public health indicators remain dire as well. Medical NGOs and UN agencies warned that Yemen's fragile gains against the cholera epidemic and malnutrition could be reversed without continued support. Doctors Without Borders, MSF, reported this week that malnutrition rates among young children are still alarmingly high in many Yemeni districts, far exceeding local clinics' capacity. 1 in 5 children under 5 in some regions suffers acute malnutrition, according to UNICEF, making them extremely vulnerable to infections. A key concern is cholera. The waterborne disease remains endemic in Yemen due to contaminated water and collapsed sanitation infrastructure. Although the massive cholera outbreaks of 2017 to 2019 have been contained, sporadic surges continue. Health experts pointed out that over 1 million malnourished Yemeni children are at risk if a new cholera wave spreads, as malnutrition weakens immunity to survive diarrheal illness. With a late July to September period typically seeing cholera spikes, due to rains and flooding, aid groups are pre-positioning for fluids and oral rehydration salts. The WHO's latest health emergency appeal for Yemen, issued in 2025, seeks $58 million to maintain cholera treatment centers, run immunization campaigns, and support 10.5 million Yemenis with basic health services. Another looming threat is dengue fever. Cases have been rising in coastal areas like Hodeidah as mosquito control efforts falter. Yemeni public health officials, working with scant resources, are focusing on community health education, such as safe water use and early treatment seeking, to mitigate these challenges. Yemen's situation underscores the interplay between conflict, economic collapse, and disease. Even as active fighting has lessened recently, the damage to infrastructure and social determinants of health continues to generate emergencies. Communicable disease control efforts produced a mix of positive news and ongoing concerns. Polio. In Syria and Iraq, health teams continued aggressive vaccination campaigns after the detection of vaccine-derived polio cases last year. This week, UNICEF reported high coverage in recent supplemental immunization rounds in northeast Syria, though conflict zones remain hard to reach. In Pakistan and Afghanistan, which influence polio importation risk to the Middle East, July saw a lull in wild polio cases, raising cautious optimism. Middle Eastern countries are staying vigilant with travelers from those regions. Mpox, monkeypox. Egypt's Ministry of Health stated on July 26 that no Mpox cases have been detected in the country, dispelling rumors on social media. Egypt has been screening travelers and raising awareness, given small outbreaks in other regions, and so far has remained Mpox-free, as have most Middle Eastern nations in 2025. COVID-19. The coronavirus is largely under control in the region at this stage of the pandemic, with sporadic cases but no major surge. However, health officials still encourage vaccination boosters for at-risk groups. For instance, the UAE this week approved a new bivalent vaccine targeting recent variants for use as a booster in the fall. In conclusion, the public health challenges of this week painted a picture of two Middle Easts. In the conflict-ridden and poorest areas, basic survival needs, nutrition, clean water, vaccinations are the priority, and the health system is part of the humanitarian response. Here, progress is measured in lives saved by aid convoys and temporary clinics. In the more stable and wealthy parts, public health efforts focus on maintaining gains, like preventing COVID resurgence, or heat safety, and addressing chronic issues like obesity and traffic accidents through prevention. The juxtaposition is stark, as malnutrition kills children in Gaza and Yemen. Countries like Qatar and the UAE simultaneously grapple with diseases of affluence such as diabetes. This dual burden requires tailored strategies, emergency relief and resilience building for some, and lifestyle modifications and health education for others. The region's public health authorities, often with support from international agencies, are challenged to respond to immediate crises without losing sight of long-term health goals. Next is wellness and health promotion. Health promotion and wellness initiatives provided some optimistic notes amid the challenges, as communities and governments across the Middle East continued efforts to encourage healthier lifestyles and preventive care. In the UAE, authorities took aim at dietary habits by announcing a forthcoming sugar tax. Building on its earlier excise taxes on soda and energy drinks, the UAE confirmed plans to introduce a new sugar-sweetened beverage tax in 2026 to disincentivize excess sugar consumption. The policy, revealed in mid-July, will levy a tariff on drinks with high sugar content, and forms part of a broader preventive strategy to combat obesity, diabetes, and dental disease. Public health campaigns are expected to accompany the tax's rollout, educating residents on the links between sugary drinks and chronic conditions. This move aligns the UAE with regional neighbors like Saudi Arabia and Oman, which implemented similar sin taxes on unhealthy products in recent years as a way to nudge consumer behavior toward healthier choices. Health advocates lauded the UAE's announcement, predicting it will particularly benefit youth health by reducing access to sugary soft drinks in schools and entertainment venues. Community-level wellness programs were also active. In Bahrain, the expat community benefited from a creative public-private initiative dubbed Healthy Pinoy 2025. Launched on July 30 by Bahrain's Al-Hilal Healthcare Group in partnership with the Philippine Embassy, this month-long campaign offers free health screenings to all Filipino nationals in Bahrain throughout August. At the kick-off event, Bahrain's Filipino expatriates were provided complimentary blood tests, checking sugar, cholesterol, kidney and liver function, etc., and medical consultations. The campaign also features weekly health talks on topics like hypertension and diabetes prevention, delivered in coordination with community leaders. The Philippine ambassador praised the initiative as a model of collaboration to promote migrant workers' health, noting it would be held every year. For Bahrain, which hosts a large South Asian and Southeast Asian workforce, such targeted wellness programs help reach populations that might otherwise face barriers to care, due to cost or hesitancy. By bringing free preventive services directly to communities and in culturally appropriate ways, Bahrain is addressing wellness in an inclusive manner. This complements national efforts. For instance, Bahrain's ongoing National Healthy Cities project, mentioned earlier, also emphasizes community engagement in health, encouraging municipalities to facilitate exercise opportunities, farmers' markets, and smoke-free public spaces. 7 Bahraini towns have now attained WHO Healthy City status, reflecting measurable improvements in environmental and social determinants of health as a result of these programs. Kuwait similarly invested in wellness promotion through its Healthy Cities initiative. As noted, 18 Kuwaiti cities are part of the WHO network, and this week officials cited those local programs such as Safat City's urban cycling paths and Jara's community nutrition workshops as key to improving residents' daily health behaviors. Kuwait's Ministry of Health used social media to highlight success stories from its Healthy City projects, aiming to inspire other municipalities. For example, in Abdali, community-led cleanup campaigns and new park installations have increased outdoor physical activity by 30% according to Mo data, and in Salmiya, Health Village, Expo held on July 25 drew hundreds for free fitness classes and medical checkups. These anecdotal successes feed into Kuwait's strategy of making healthy choices easier at the community level. In Saudi Arabia, the cultural shift around mental health and wellness continues to gain momentum. While not a specific event this week, public discourse remains influenced by earlier initiatives that are bearing fruit. Young Saudis are more openly discussing mental well-being, and the National Center for Mental Health Promotions campaigns, ongoing through the summer, use social media influencers to destigmatize seeking help. The popularity of mental health apps like Sita and the government-supported Careboon platform, which offers free counseling sessions, was evident in rising user numbers. Saudi mental health professionals note that even conservative families are increasingly supportive of therapy for issues like anxiety or depression, a marked change from a decade ago. On July 27, a symposium in Jeddah on workplace mental health saw large attendance from the corporate sector, indicating how broad the reach of this mental health revolution has become. Such wellness-oriented education complements the kingdom's more traditional health promotion efforts on topics like exercise and diet. Indeed, Saudi Arabia has simultaneously been running its Live Healthy initiative, part of Vision 2030's Quality of Life program, which sponsors community sports events and healthy cooking television segments. The convergence of physical and mental wellness in Saudi outreach reflects a holistic view of health that is gradually taking root. Meanwhile, Qatar kept up its focus on sports and wellness as part of the national culture. In the wake of its successful FIFA World Cup health legacy programs, Qatar's sports authorities in late July organized free summer fitness camps for youth. The Active Qatar summer program enrolled thousands of school children in swimming, athletics, and football clinics, emphasizing physical activity to counter sedentary lifestyle trends. Health promoters from Qatar's primary health care corporation gave interactive sessions to campers about nutrition and hydration in Doha's heat. These efforts tie into Qatar's national health strategy, which explicitly includes physical activity and wellness targets to reduce obesity rates. Though specific data from this week are not yet available, the continuity of programming indicates Qatar's commitment to year-round wellness, leveraging its world-class sports infrastructure for community benefit. In summary, wellness and health promotion activities in late July were characterized by creativity, community engagement, and multi-sector collaboration. Whether through taxation policies to reduce harmful consumption or through free health services and campaigns to empower individuals, Middle Eastern countries are increasingly proactive about prevention. There is recognition that curative medicine alone cannot solve the rising burden of non-communicable diseases. Healthier lifestyles must be cultivated. What's heartening is the diversity of approaches, from top-down policy, like Bahrain's insurance or the UAE's sugar tax, to grassroots programs, like Healthy Pinoy or Kuwait's local Healthy City projects. The consistent thread is an emphasis on education and accessibility, making sure people have the information, resources, and supportive environments needed to live healthier lives. Over time, these wellness initiatives aim to bend the curve on conditions like diabetes, heart disease, and mental illness, which are major sources of morbidity in the region. The progress is gradual and challenges, like cultural norms or economic constraints, persist, but each week's efforts contribute to slowly shifting norms toward valuing and sustaining good health. Always exciting is digital health innovation and its developments. Digital health innovation continues to gain traction across the Middle East, as countries deploy new technologies to enhance care delivery and health system efficiency. Telemedicine and virtual care were prominent themes, accelerated by both policy pushes and practical needs. In Saudi Arabia, the massive healthcare operation during the Hajj pilgrimage showcased the benefits of digital health tools. The Ministry of Health revealed that it had equipped high-risk pilgrims with wearable smart monitors linked to the Seha Virtual Hospital in Riyadh, allowing remote specialists to track pilgrims' vital signs and intervene if needed. Additionally, telemedicine, virtual clinics, were on standby so that any pilgrim in the holy sites could consult a doctor via video if in-person facilities were overcrowded. This model, integrating on-the-ground care with remote expertise, proved successful, with officials reporting multiple cases where virtual cardiologists guided on-site medics to manage cardiac events, for example. Buoyed by this outcome, Saudi health leaders are looking to expand telehealth services nationwide. Plans are underway to link more hospitals, especially in remote regions, to the Seha Virtual Hospital network so that patients can receive advanced consultations without traveling to major cities. This week, the Health Ministry announced an upcoming pilot in the sparsely populated Northern Borders province, where local clinics will be connected to central specialists for dermatology and mental health services as a test run. In Kuwait, telemedicine also featured in new international collaborations. As noted, the most recent agreements with French institutions include developing robust telemedicine programs in Kuwait. One concrete element is a planned tele-oncology service. Kuwaiti cancer patients will be able to have their cases reviewed via live multidisciplinary tumor boards that include top oncologists from Paris, improving treatment planning without the patient leaving Kuwait. Likewise, French cardiologists will be available for second opinions on complex cardiac cases through a secure telemedicine portal. Over the past week, Kuwaiti IT teams have been working with French counterparts to ensure the digital infrastructure, high-speed connections, translation support, data security, is in place for these services to launch by year's end. This indicates how international partnerships are fast-tracking digital health adoption in countries that have the resources to invest but benefit from outside expertise on best practices. Kuwait is also concurrently upgrading its National Electronic Health Record (EHR) system to ensure that data can be easily shared between local and overseas providers. Health officials there see telemedicine as a means to both improve quality and reduce the need for costly treatment abroad, which Kuwait has historically funded for complex cases. The UAE has been a regional leader in digital health, and while no major new platform was unveiled this week, ongoing initiatives continued. Dubai's and Abu Dhabi's health authorities are in the middle of rolling out a unified electronic medical record across government and private hospitals, a project known as Riyati and Malafi respectively. By linking dozens of facilities, the aim is to create a seamless patient record accessible anywhere in the country, enabling better coordinated care. In late July, MOHAP reported that over 3 million patient records had been integrated into the Riyati system from clinics and hospitals in the Northern Emirates. This includes data from primary care, pharmacies, and even teleconsultations. The ministry highlighted that once fully operational, the nationwide EHR will reduce duplicate tests, flag drug allergies, and empower patients with a personal health portal. The UAE is also experimenting with AI in healthcare. Abu Dhabi's Seha network recently concluded a trial of an AI-driven symptom checker chatbot for its 24/7 telemedicine hotline, which, according to preliminary results shared this week, was able to correctly triage callers in 90% of cases, directing those with minor ailments to self-care or pharmacy options and fast-tracking those with red flag symptoms to emergency consultation. With such promising results, SEHA is likely to expand the use of AI triage to reduce burden on clinicians. In Iraq, efforts to digitize health information systems continued, focusing particularly on public health data. With WHO support, Iraq has been scaling up an electronic logistics management information system, ELMIS, based on DHIS2 to track supply and distribution of medicines and vaccines. By end of Q2 2025, the ELMIS was operational for reproductive health commodities in numerous provinces, and this week health officials were training staff in additional governorates to use the system. This digitization helps ensure clinics are stocked and can signal shortages in real time, crucial for a country working to rebuild its health infrastructure. Iraq is also hosting its first major health expo in Baghdad in late 2025, and promotion for it ramped up on social media this week, with themes highlighting digitization to hospital modernization. That indicates Iraq's intent to attract digital health innovators and learn from regional peers. Indeed, neighboring Jordan's successful implementation of Hakim, a national EHR, and telepsychiatry services has been a reference point for Iraqi health planners aiming to leapfrog into the digital era. Lastly, cybersecurity and data protection were underscored as priorities. In light of increased cyber attacks globally, health ministries in the Gulf used the relatively calm summer period to conduct audits and drills. The UAE's Cybersecurity Council mentioned this week that it had tested hospital networks for vulnerabilities and is developing specific guidelines for health data protection. Ensuring patient privacy and system resilience is recognized as foundational for digital health trust. In conclusion, digital health momentum in the Middle East is unmistakable and multifaceted, encompassing telemedicine, health informatics, AI, and mobile solutions. The week's developments show incremental but steady progress, integrating systems here, trialing new tools there, and learning from real-world deployments, like Hajj, to refine digital strategies. While resource-rich countries gallop ahead with cutting-edge pilots and national platforms, even resource-constrained countries are finding niches where digital tech can make a difference, for example, using basic mobile services for health education in refugee settings. Challenges remain, including digital literacy in some patient populations and ensuring equitable access. Rural internet connectivity is a limiting factor in parts of MENA. However, the trajectory suggests that digital innovation will increasingly become ingrained in how Middle Eastern healthcare is delivered. Over time, this could help address some systemic issues, improving access in remote areas, alleviating provider shortages via teleconsultations, and empowering patients with information. The cultural acceptance of these tools is also rising. The pandemic accelerated it, and now the convenience is driving further adoption. As one health minister quipped at a regional conference, in a region known for mobile phones and social media, why shouldn't health ride that digital wave? This week's array of projects and plans indicates that it indeed is riding that wave. Finally, let's discuss population health management. In the realm of population health management, which focuses on improving health outcomes for entire groups through preventive care, screenings, and chronic disease control, several Middle Eastern countries reported major campaigns and achievements during the week. Egypt stood out with its sweeping public health initiatives reaching millions. The Ministry of Health announced that the third edition of its 100 Days of Health nationwide campaign, launched on July 15, had delivered an astonishing volume of free medical services in its first 10 days. By July 26, over 15.1 million services had been provided under the campaign's umbrella. These services range from primary care consultations and blood pressure, glucose screenings to dispensing medications and performing minor procedures, all at no cost to citizens. The initiative mobilizes hundreds of mobile clinics and health teams across all governorates, essentially surging the capacity of the health system for a focused period to catch unmet needs. For example, during a single day, July 25, the campaign handled more than 570,000 patient encounters, including nearly 134,000 services in primary care and family planning and 184,000 services in therapeutic care, such as specialist referrals. It also integrated Egypt's numerous presidential health initiatives like the Women's Health Screening Program and Chronic Disease Management under one umbrella during the 100 days, thereby expanding reach. Indeed, The campaign's statistics include tens of thousands of screenings performed for breast cancer, diabetes, hepatitis C, and other public health priorities. Health officials indicated that the campaign's multi-pronged approach, combining preventive screenings, treatment, and health education, is yielding positive outcomes. Many Egyptians who rarely seek care have been diagnosed early with hypertension or diabetes and are now entering follow-up care. The 100 Days of Health concept reflects a proactive population health strategy by Egypt, tackling issues of access and awareness in a short, intense burst. Given its evident success, millions served in days, the government is likely to repeat such drives and perhaps inspire similar models in other countries with large, distributed populations. Another Egyptian success in population health management was the continued impact of the Presidential Women's Health Initiative, which focuses on women's preventive care, especially breast cancer screening and reproductive health services. On July 26, the Health Ministry reported that this initiative has now recorded over 60.5 million visits by women since its inception in 2019. This astounding cumulative reach, roughly equivalent to every Egyptian woman over 18 being screened at least once, includes 22.7 million first-time screening visits and nearly 25 million follow-up visits. Over 823,000 women have been referred for advanced diagnostics, mammograms, biopsies, after flagging potential issues. As a result, more than 33,500 breast cancer cases have been detected and treated at an earlier stage than they likely would have without the program. The initiative also integrates screening for diabetes, hypertension, and obesity in women, providing a more holistic health check. This week's figures highlight how sustained, large-scale prevention programs can alter population health trajectories. Egypt is already seeing a plateauing of advanced breast cancer presentations, attributed to early detection. The free screenings, offered at thousands of primary healthcare units nationwide, and public awareness around them have improved health-seeking behavior among Egyptian women. It's a model of population health management where strong political will, adequate funding, and community mobilization converge to tackle a major health issue at scale. In Qatar, population health efforts took aim at chronic disease management, with new research shedding light on gaps. A study published in BMJ Public Health, and reported in Qatar's media on July 28, examined why many Qatari adults with type 2 diabetes struggle to control their blood sugar despite regular primary care visits. The findings pointed to systemic issues such as suboptimal care coordination, patient adherence challenges, and possibly clinic resource constraints. For instance, some patients had gaps in patient education, not fully understanding their treatment plans, and others faced delays in intensifying therapy when needed. Armed with this data, Qatar's Primary Healthcare Corporation is now moving to strengthen its diabetes management program. This week officials outlined plans to introduce case management for poorly controlled diabetics, assigning dedicated diabetes care nurses to high-risk patients to provide follow-up calls, diet counseling, and appointment reminders. They are also enhancing training for GPS on the latest diabetes guidelines and creating a registry to more closely track outcomes. The goal is to increase the proportion of diabetic patients meeting their glycemic targets, thereby reducing complications over time. This targeted approach, using research to drive improvements in care delivery, exemplifies population health management through quality improvement. Qatar's relatively small population, just under 3 million, and strong health infrastructure give it an advantage in quickly implementing such programs and monitoring their effectiveness. In Bahrain, the imminent launch of the National Health Insurance, discussed in Policy section, is fundamentally a population health management reform. By mandating coverage for all residents, Bahrain aims to ensure everyone is attached to a primary care provider and receives essential preventive services. Over time, this could significantly improve management of population health metrics like vaccination rates, cancer screening uptake, and chronic disease control, because insurers and providers will be incentivized, through payment models, to keep their covered population healthy. Ahead of that rollout, Bahrain continued its routine population health activities, for example, its mobile school health program, which visits schools to provide checkups and health education, is preparing for the new academic year with an updated curriculum on nutrition and mental health first aid for students. These kinds of proactive, community-based services complement the more system-level changes underway. Saudi Arabia places population health at the core of its Vision 2030 health sector transformation program. One element in focus this week was the concept of health in all policies, an approach Saudi officials have been championing. At a recent GCC public health conference, Saudi representatives shared how they are embedding health considerations into urban planning, education, and even transportation policies to address determinants of health. Practically, this has meant initiatives like mandating pedestrian-friendly neighborhoods in new city plans to encourage walking and reduce traffic injuries, and taxing sugary beverages, as the UAE is doing. Saudi's population health management also involves massive data systems. The Nafis platform aggregates data from various sources to identify trends such as regions with low screening uptake or high asthma admissions, allowing targeted interventions. During the last week, the Saudi MO used its data analytics to pinpoint which primary care centers needed extra staffing for their evening clinics based on community chronic disease loads, and redeployed staff accordingly. It's a subtle operational detail, but it illustrates a shift toward data-driven population health management. Additionally, the kingdom's experience with managing millions of pilgrims safely is being repurposed for domestic use. For example, the heat stress prevention protocols used during Hajj, like distributing electrolyte packets and setting up cooling tents, are now being considered for implementation for outdoor workers and athletes nationally during heat waves. In the UAE, population health management manifests in high-tech ways too. Abu Dhabi's Department of Health has been building a genome program, and this week it reached a milestone of sequencing over 400,000 Emirati citizens' genomes. The aim is to create a genomic database that can inform personalized medicine and early risk identification for the Emirati population. Already, this initiative has led to pilot screening of newborns for rare genetic disorders, expanding the panel of conditions beyond the traditional ones. This is a long-term population health investment. Over time, it could substantially reduce the burden of genetic diseases in the population through early intervention and informed marriage counseling for carriers of recessive genes, a sensitive but important matter in the Gulf. Dubai, meanwhile, continues its push on occupational health as part of population health. Just this week, Dubai municipality noted an uptick in companies complying with new wellness standards in labor accommodations, ensuring proper ventilation, recreation spaces, etc., which contributes to better mental and physical health outcomes for that population segment. Another key facet of population health in the region is vaccination and disease elimination programs. Polio, as mentioned, remains on the radar. Hepatitis C elimination is another big regional goal. Egypt's success in treating millions of Hep C patients has become a blueprint. This week, some countries, e.g. Pakistan and Iraq, sent delegations to Cairo to learn about Egypt's screening and treatment campaign, with the idea of implementing similar models. On July 28, World Hepatitis Day, the WHO commended Egypt for achieving a dramatic reduction in Hep C prevalence and encouraged more countries to follow suit. Population health management at a multinational level. In conclusion, population health management efforts during the week demonstrate a clear trend. Middle Eastern health systems are moving beyond reactive care and investing in preventative, proactive strategies to improve health indicators of their entire populations. The approaches vary based on context. Large-scale government campaigns in populous countries, tech-enabled data use in Gulf states, or insurance reforms in smaller nations, but the objective is consistent: to keep people healthier and detect problems earlier. By managing health at a population level, these countries hope to reduce the need for expensive tertiary care and improve quality of life, which in turn can boost productivity and economic development. The week's news shows that these efforts are yielding measurable results: screening millions, treating millions, improving control of chronic conditions. Challenges certainly persist: ensuring equitable coverage in rural or conflict areas, sustaining funding, and changing public behaviors, but the commitment to population health is stronger than ever. If these initiatives maintain momentum, the Middle East could see significant improvements in key health outcomes, like life expectancy and disease-specific mortality rates, over the coming decade, validating the importance of population health management as a pillar of modern healthcare. So let's summarize this week's review. The last week of July 2025 encapsulated the Middle East's two-track journey in health and wellness. On one track, the region's stable and prosperous states accelerated toward cutting-edge, integrated healthcare systems. We saw Gulf countries inaugurating high-tech hospitals, rolling out national insurance and electronic records, partnering globally on research, and leveraging digital health at scale. These developments speak to a forward-looking vision, one where quality care, innovation, and prevention drive the agenda, backed by significant investment. On the other track, countries grappling with conflict and economic strain faced unrelenting public health emergencies. Gaza's health system neared collapse under siege, Yemen continued to battle malnutrition and cholera, and Lebanon struggled to keep basic health services afloat amid a financial freefall. The contrast is stark, yet not absolute. Middle-income nations like Jordan and Egypt straddle elements of both tracks, making notable gains in infrastructure and public health even as they contend with resource constraints and pockets of poverty. A few major trends emerged clearly from this week's narrative. First is regional integration and cooperation in health. Whether it's Saudi Arabia funding a hospital in Bahrain, France and Kuwait teaming up on telemedicine, or Egypt and China co-developing vaccines, cross-border partnerships are increasingly common and essential. They allow for resource pooling and knowledge exchange that elevate the region's healthcare collectively. Second is the centrality of technology and innovation, from digital tools improving pilgrim care and national surveillance systems in Oman, to AI and genomic programs in the Gulf. Technology is seen as the catalyst to leapfrog health outcomes. Countries are embracing e-health and biotech not as luxuries but as necessary components to meet their population's needs efficiently and effectively. Third, the week underscored the importance of preventive and value-based approaches. The massive screening campaigns in Egypt, the sugar tax and wellness drives in the Gulf, and the insurance reforms in Bahrain all aim to keep people healthier and reduce the burden of disease before it overwhelms hospitals. This shift from curative, episodic care to a more continuous care model rooted in prevention and primary care is a fundamental reorientation in how Middle Eastern health systems operate. It's spurred by the realization that the old model is financially unsustainable and yields poor outcomes for chronic disease, which is now the dominant burden in many countries. Regional contrasts also provided lessons. The Gulf states' ability to implement large projects quickly, e.g., Kuwait bringing several hospitals online simultaneously, contrasted with slower progress in less affluent countries, pointing to the role of funding and governance in health system performance. Yet, even lower-income countries achieved impactful results through focused programs, as Egypt did with relatively low-cost screening campaigns. This suggests that political commitment and smart planning can sometimes compensate for budget limitations. Another observation is the resilience of health workers and systems under extreme duress. The bravery of Gaza's and Yemen's medics saving lives in dire conditions resonated alongside the reports of infrastructure achievements elsewhere. The region's health narrative is thus also one of resilience and hope amidst adversity. In summation, the week revealed a region in transition, modernizing at a rapid clip in some areas while still in crisis in others. Major trends include the blending of healthcare with national development goals, the harnessing of innovation to solve old problems, and a growing ethic of prevention and wellness. These trends, if sustained, promise long-term benefits: a Middle East where polio and hepatitis are memories, where fewer people develop preventable complications of diabetes, where mental health is cared for as openly as physical health, and where even remote or marginalized communities have access to essential care. The seeds of that future are visible in the initiatives and outcomes of this late July week. Realizing that vision fully will demand perseverance in funding, in training the next generation of health professionals, in navigating political obstacles, but the trajectory is set in the right direction. Each new hospital wing opened, each million screened, each policy reformed is a building block toward healthier societies across the Middle East. The coming weeks and months will further test these systems, with seasonal challenges like summer heat and potential disease flare-ups, but the experience and improvements gained thus far equip the region better than ever to meet them. In the midst of challenges, the prevailing narrative is one of progress and hope in the realm of health and wellness. For more information about any of the topics discussed here, or if you would like to learn more about Al-Ghaf Dynamics and our extensive range of services and solutions in healthcare, life sciences, and wellness for the Middle East, please don't hesitate to contact us. Visit us at our website or email us directly. Additionally, scan our QR code for all our links. Thank you for listening and see you next week.